I have two questions left for you. The first one
Okay.
should be an easy one for you.
Thank you.
How do we fix the therapy profession?
Wow, thank you, Ryan. That's a really big one, isn't it?
Yes, it is.
God, where do we start? What I would like to see is that we get back to basics in some form or other. We have to go back to the basic idea of therapy being for unique individuals, and that you actually treat them, you give them person-centered care, which is effective, which is based on evidence, it's evidence-based care. All of that has to be reinstated somehow. Now, how we go about doing that, I don't know. Whether we have to set up alternative institutions, maybe we do. I do worry that I don't know what's happening in the States, actually. I'm not trying to sidetrack here, but is there any sign that courses, for example, in the States are having to respond to some of the changes that Trump is asking them, like stripping out EDI and things like that?
Certainly not from what I've seen. It's kind of, this is a tough issue because if the Trump administration says you're not allowed to get any funding if you have some critical social justice, however they word it, these are people who their religion, their cult in some sense, says you have to push critical social justice. That's your only mission in the world. So when those two forces run up against each other, who wins?
That's a question I can't answer, but I think we have to keep the ship afloat, Ryan. Those of us who truly believe in traditional therapies and that we believe in preserving the well-being of our clients, we have to keep pushing either for alternative institutions that we can set up. There is a problem with that, isn't there? In the ethical codes and so on of the regulatory bodies don't match somehow. So I don't have the answers to that, but I think we have got to keep the light on. We have got to keep forging away to make sure that we preserve traditional therapy and make sure that our clients that we see, at least, are getting proper therapy that improves their well-being and restores their mental health.